Hello, we're answering questions on sexual health. I'm joined by Dr. Catherine Hood. Hello, Catherine.
Hello.
A question here from a 34-year-old who, even though she says, I enjoy sex, I'm not sure if I've ever had an orgasm, wants to know, how can I tell if I've ever had one or not?
That's really difficult, actually. I mean, it's a misconception that, you know, all women orgasm all the time or have multiple orgasms. And I think if you're really not sure, it can be quite daunting, thinking, well, you know, what's wrong with me? The fact is that actually probably about 10% of women never orgasm. And that doesn't mean they don't enjoy sex or have a satisfying sex life. They often do. It's just that they have what's called a very high orgasmic threshold. So in order to reach that level of release, it takes a lot more stimulation than perhaps normal. I think the first thing is to find out what works for you. And a lot of women, again, are very nervous about touching their own bodies. And this is something that they tend to get better at as they get older. So, you know, she's now in her 30s, and I hope that she feels confident enough to actually spend some time trying to work out what does it for her. Women are not brought up in terms of, we don't talk about masturbation an awful lot, but it's a thing that a lot of women do, and it's a great way to actually work out what works for you. And unless you know what stimulates you, how do you expect your partners to be able to do it for you in the bedroom?
Yes,
you know? So take some time out, learn to relax, really let go, and just touch yourself, get used to touching yourself. And sometimes people find vibrators help in terms of giving good clitoral stimulation, because stimulation of the clitoris is very important for most women in terms of reaching climax. And it may be that your partner's not doing that quite enough for you. So find out yourself what works. And once you know how to get yourself there, you can teach your partner how to get you there.
And might be easier to let go. That's the key, isn't it? Yeah, on your own, first of all.
Absolutely, because when you've got that other person there, you might feel watched or judged, or you know, that you need to perform. So do it on your own without that pressure first.
Oh, very good advice. Thank you very much. And if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.